Hello, everybody. Well, this is Parul and Kunal from Practice Forces. We are a medical billing company and we are coming live at this moment because we felt there is an urgent need of explaining CARES Act, which was announced recently in last couple of days. President has signed a $30 billion award for which is going into the healthcare systems to support physicians and their financial situations. The purpose of this award is to incentivize physicians based on their historical analysis from year 2019. We have been getting, as a billing company, we both are getting a lot of questions from physicians. So we thought we would go live and answer those questions um, based on the questions we received from our physicians, as well as based on the law which has recently been passed. So I have these two-page documents which has general questions which are answered by Medicare. Uh, but on the top of it, we're going to provide what is our interpretation and how physicians can see these funds coming directly into their bank account very soon. So welcome, Parul. Thank you very much to be on this live session. We wanted to know, I know it's a $30 billion into the healthcare system, and physicians is a major part of it, including hospitals and everybody. So who's going to be eligible for this money?
So basically, the facilities and providers are eligible for
Mm-hmm.
this money.
So anybody who has a tax ID, a physician, medical care provider, they can receive the money.
Yeah.
How are they going to receive it?
So what Medicare is doing is distributing this money based on tax ID.
Okay. So what about the solo providers who does not have a tax ID?
Every provider will have a tax ID,
Mhm.
and if you are an employed physician under a big group,
Mm.
you will not get the money based on your billing, but your provider, your employer will get the money.
Okay. So what about there are physicians who are working in a group as well as other groups? So how would Medicare determine uh, the total amount? What's the formula? Like, did they derive a formula like 30 billion times? I know they said here there is a formula for total $484 billion is the industry. So what's the
So the
formula?
base formula, what we could see based on the payments that my clients have received today,
Mm-hmm.
it's about 6 to 6.5% of your payments from 2019. So let's say if you receive 100,000 payment in 2019, Medicare has done a EFT in your bank account
Mm-hmm.
of $6,000.
And some of your
Yes.
clients have already received the funding.
Yep.
So, what is the mode of the funding? I mean, I know we have several clients. I mean, this is our office we are doing right here. What's the mode of funding? How would physicians know that this money is called?
It's called it is coming by HHS.
Mm-hmm.
It's coming a EFT directly in your bank account, and the good news is it's a stimulus money. You are not to refund that money to Medicare.
Okay, so it's not like a loan program like they have other programs
Mhm.
like payment payroll protection and other fundings. This is a stimulus money, which means this is an incentive based on your Medicare population from last year. So, and the money is coming automatic. The uh, physicians and the practices which are not set up automatic,
They'll get paper checks.
they will get paper checks. Okay, that's what I was coming from. So, what are the terms and condition? Any specific terms and condition for receiving this funding, or?
No, you are not applying for it. It's because it's not a loan program. You're not applying for it. If you were a physician or a group practice who worked with Medicare and have received funds in 2019, you will automatically get this money. What Medicare is saying is you have to do a attestation within 30 days on their website, which they will start as of April 13th. To accept it, or they have not released too much information, so we can worry about that next week. But yeah, with Easter, Good Friday, enjoy the
Happy Easter.
stimulus payment.
Yeah, this is a great news for especially those physicians who are just seeing patients irrespective of the situation they are into. I know a lot of physicians, they are working from home, they are doing telemedicine, They're seeing patients remotely through FaceTime, through computer, through video chat, and they're not even worrying about whether they are getting paid or not. So this stimulus money is a great way of incentivizing those physicians who are working very hard in this special, circumstances. So again, my question comes back to the solo practitioners, because I know there are solo practitioners who are a part of some group, they are part-timers. How would Medicare determine their portion of the incentive?
If you are employed under a large practice, your practice will get the money under the tax ID.
But if he does some part under his own, then
They
he would
should-
get,
they should
so
get
he
the
would get
payment.
both probably.
Right. I think if you're employed in 2019, if you're employed under a group, then the employer gets the money. And based on what your agreement is, they might or might not pay.
So I think so it's basically my understanding, according to what you're saying, is if a physician is working as a solo provider, as a hospitalist, let's say, or they are also a part of a physician group, Medicare will basically determine your total number of visits by their individual NPI. And if, let's say, 10% patients he sees as a group and 20% he sees as an individual, he would get money in his both accounts, basically.
If
Is
you
that
are
right?
employed, you don't.
I mean, you get from the
Right.
tax ID, your employer will get it, but you would also get it as an individual if there are claims
Yes.
going under yours.
Yes.
So he should basically see two checks or a payment from the employer.
In all essence, if you were separated from being a hospitalist, if you were separated as a hospitalist and started your own medical practice in 2019, this is a bonus for you where you don't have to ask the hospital to pay you the money, because it will go in your bank directly. For entrepreneurs who started their own practice, this is your stimulus money.
It's a bounty. Well, I don't know if you have received any questions or not. Is anybody joining? If not, you can ask a question if you have, but we are going to stay here. You can connect us through our Facebook page. We are also available on LinkedIn, and there are numbers on our website, practiceforces.com. We are working, some of our employees are working from home. That's why we were able to record this video right in the middle of our office. And we are here. So if you have any question, feel free to reach out to us. Again, as I said, there are 4 or 5 different programs to financially incentivize physicians and the healthcare systems. And we are aware of all of them, and we are working hard to allow our physicians and to help them into, sending their applications for PPP, advising you what you should be doing, whether you want to have Medicare advance payments or not. That's another good question actually came to my mind. Can you share some light about Medicare advance payments? Because a lot of people are asking whether we should apply for Medicare advance payment or not. What do you think, Parul?
So for the advance payment, basically what it is based on your collection of 2019 quarter 4, Medicare is, if you collected, let's say 500,000 in Q4 for 2019, Medicare is giving you that payment as advance, a loan, which you have to return after 210 days.
And it has no, this is a interest-free loan?
It's interest-free. They pay you one time. It comes as a EFT to your bank. But from future payments that starts in August of 2020, from then on, Medicare will process your claims but not make you the payment. They will in fact do the deduction for this from the 500,000.
What if there are people who are in the transition, like they they worked under some other group in 2019 and now they're planning to go by their own? What would they do? Because if they claim the money based on last year's numbers, how would they pay back with a different tax ID?
So that's why their Medicare is paying by tax ID. If it works for your group practice to have that calculation by the NPI, by your partnership, if under a tax ID you have all employees as the physicians, no partners, then it's easy. The solo owner of the practice can keep the money.
Or decide how to disperse it.
They won't have to disperse it, right? If you
Well,
are a
if
solo
it
owner,
belongs to, yeah, solo
if
owner
solo
keeps
owner,
it for himself, but
right,
if it is a group practice, they have to disperse
right, right,
according to their, because, but it would be a loan against your
right.
previous history.
Yeah, and that payment is coming, Medicare claims about 7 days. It's coming even faster than that.
So both are very good programs. Both are targeted for healthcare. And thank you very much for listening us. Again, if you have any question, reach out to us through mail, text, Facebook, chat, whatever you want to do. We have a direct chat system through our website, practiceforces.com. You can leave a message for us. Thank you very much for listening. We'll keep you updated on this channel. So please subscribe it. Thank you.
Thank you.